Is CAR T-cell therapy an option for B-cell lymphoma? Imagine a treatment that uses your own immune system to fight cancer more precisely than ever before. That's what CAR T-cell therapy offers for some people with B-cell lymphoma. But is it right for everyone? Let's explore how this innovative approach fits into the treatment landscape for B-cell lymphoma, especially for those whose disease has come back or didn't respond to initial therapies. B-cell lymphomas are cancers that develop from B lymphocytes, a type of white blood cell involved in immune responses. The most common form of non-Hodgkin lymphoma is diffuse large B-cell lymphoma. Usually, treatment begins with chemotherapy combined with immunotherapy, which can cure many patients. However, some patients experience relapse or their disease resists these treatments. For those with relapsed or resistant disease, CAR T-cell therapy has become a significant option. It is a form of personalized immunotherapy where a patient's own T-cells are collected and modified in a lab. These T-cells are engineered to produce chimeric antigen receptors, or CARs, on their surface. These receptors help the T-cells recognize and attack cancer cells that carry specific markers, most often a protein called CD19, found on most B-cell lymphomas. Once these T-cells are modified, they are infused back into the patient's bloodstream. There, they seek out and destroy the cancer cells. Clinical studies have shown that CAR T-cell therapy can lead to long-lasting remissions. For example, in some trials, over half of the patients with aggressive B-cell lymphoma remained in remission after several years. Some of these patients might even be cured, but longer follow-up is needed to confirm this. Importantly, CAR T-cell therapy isn't limited to young, healthy patients. Research indicates that even older adults, including those in their 80s, can tolerate and benefit from this treatment. This is crucial because older adults make up a large portion of B-cell lymphoma cases and are often underrepresented in clinical trials. Like all treatments, CAR T-cell therapy has risks. The most serious are cytokine releases syndrome, which can cause flu-like symptoms, and neurotoxicity, which can affect the nervous system. These side effects can be severe but are usually manageable with supportive care. The specific risks depend on the individual and the particular CAR T-cell product used. Currently, CAR T-cell therapy is approved mainly for patients with relapsed or refractory B-cell lymphoma after at least 2 prior treatments. It is not typically used as a first-line therapy for newly diagnosed cases, except in clinical trials exploring earlier use. In summary, CAR T-cell therapy is a promising and potentially curative option for certain patients with B-cell lymphoma, especially those with aggressive or resistant disease. It represents a major advance in lymphoma treatment, offering hope where options were limited before. However, it's not suitable for everyone, and the decision to pursue this therapy should be made with a healthcare team experienced in lymphoma care. As ongoing research continues, the role of CAR T-cell therapy may expand, but for now, it remains a specialized treatment reserved for specific clinical situations. If you or a loved one are considering this option, always consult with your medical team to understand the best approach tailored to your individual needs.